Sleep apnea, types of sleep apnea, obstructive, central, complex sleep apnea, what you should know about them. While all types of sleep apnea are linked to breathing issues while sleeping, the causes vary. If you're constantly tired and drowsy during the day, despite getting at least 7 or more hours of sleep. The amount of sleep recommended for adults by the American Academy of Sleep Medicine, AASM, in the Journal of Clinical Sleep Medicine in 2015, you should see your doctor to be evaluated for sleep apnea. According to studies supported by the ASM and published on March 15, 2016 in the Journal of Clinical Sleep Medicine. Sleep apnea is a sleep condition that affects about 30 million people in the United States, or about 12% of the population. Despite its prevalence, the condition frequently goes undetected. Because the majority of the frequent and characteristic signs of sleep apnea, such as snoring, breathing pauses, and gasping for air, occur while people are sleeping, many people may be unaware that they are having the symptoms and go undetected and untreated. Many of the defining symptoms of sleep apnea are the same in each kind, but the mechanism, or cause, of sleep apnea differs. To begin, let's look at what all types of sleep apnea have in common. People with sleep apnea have periodic pauses in breathing. The term apnea refers to pauses in breathing that last 10 seconds or longer, according to the Sleep Foundation. People with apnea experience such episodes frequently during sleep, leading them to partially wake up numerous times during the night as they battle to breathe. These partial arousals from sleep may occur hundreds of times per night in someone with severe sleep apnea. Because these awakenings are usually brief, the individual with sleep apnea may be completely unaware that their sleep is being disrupted. However, the episodes can disrupt the sleep cycle and prevent the person with sleep apnea from sleeping deeply and restfully. That's why, despite obtaining a full night's sleep, people with sleep apnea often feel extremely tired and drowsy the next day. The most common subtype of this condition is obstructive sleep apnea, OSA. Obstructive sleep apnea, often known as OSA, is the most frequent type of sleep apnea. According to the American Academy of Sleep Medicine, OSA occurs when the throat muscles in the back of your throat, which usually relax during sleep, collapse too much to allow proper breathing. The soft tissues in the back of the throat, such as the soft palate, uvula, tonsils, and tongue, are supported by the throat muscles. As a result, if those muscles collapse too much, tissues may fall back into the throat, partially or fully restricting the usual flow of air through your airway. When the airway is partially closed, a person may begin to snore, which is a common symptom of OSA. It's important to note that not everyone who snores suffers from sleep apnea. When your brain detects a lack of oxygen, it sends a signal to your body to wake up enough to reopen your airway, which may cause you to gasp for air during the night. According to Robson Capasso, Maryland, Chief of Sleep Surgery and Associate Professor of Otolaryngology and Head and Neck Surgery at Stanford University School of Medicine in California. Having obstructive sleep apnea means that not enough air gets into your lungs at night, and your brain wakes you up to breathe. Obstructive sleep apnea cases have increased dramatically in the previous 2 decades, according to research. This is most likely because of 2 major factors: obesity, which is one of the most prominent risk factors for OSA, has risen considerably, and doctors and the general public are becoming more aware of the condition, so more people are being checked and diagnosed. Continuous positive airway pressure, CPAP, is a machine that puts air pressure into your lungs through a mask that fits over your nose and mouth while you sleep. And it can be used to treat obstructive sleep apnea, CPAP. Various OSA treatment options include other breathing machines, mouthpieces designed to hold your jaw forward and open your airway, or surgery, in more severe cases, to remove tonsils or other tissue that could obstruct your airway or shift your jaw to free up your airway. Your doctor may also advise you to reduce weight and avoid lying on your back to prevent your tongue, tonsils, and other soft tissues in your throat from pushing deeper into your airway due to gravity. When the brain is involved, central sleep apnea occurs. Obstructive sleep apnea is more common than central sleep apnea. It's also more difficult to identify and treat. Central sleep apnea occurs when the brain does not deliver the necessary information to the muscles that govern breathing. Unlike obstructive sleep apnea, which is caused by a mechanical condition that restricts the airway, a neurological condition causes central sleep apnea. while central and obstructive sleep apneas have many symptoms, such as breathing pauses, nighttime awakenings, and severe tiredness during the day. Central and obstructive sleep apneas have distinct symptoms. According to the American Sleep Apnea Association, central sleep apnea frequently affects people who have underlying disorders such as a brain infection or other conditions that affect the brainstem. Severe obesity, Parkinson's disease, stroke, and chronic heart failure are among disorders linked to central sleep apnea. Certain medications, such as opioids and benzodiazepines, can cause central sleep apnea. The respiratory mechanisms in patients who take opioids on a regular basis can become numb. If your doctor suspects central sleep apnea, he or she may refer you to a sleep expert for a diagnosis, which may include an overnight sleep test to rule out obstructive sleep apnea or other sleep disorders, according to Mayo Clinic. To rule out other disorders, the sleep specialist may consult with your cardiologist or conduct scans of your brain and heart. The most common treatment for central sleep apnea is to address the underlying issues that are generating the apnea in the first place. Treating cardiac problems, for example, may help with central sleep apnea symptoms. According to Johns Hopkins Medicine, lowering the dose of medicine and employing positive pressure ventilation, such as Cpap or another form of ventilator called B-level positive airway pressure, BiPAP, can help. BiPAP, like Cpap, distributes pressurized air to your lungs, but BiPAP gives more air pressure when you breathe in than when you breathe out, whereas Cpap delivers the same amount of pressure on both inhale and exhale. Complex sleep apnea syndrome is a combination of OSA and central sleep apnea. Complex sleep apnea, a combination of obstructive and central sleep apnea, has recently been recognized by doctors as a third type of sleep apnea. Patients with this type of sleep apnea may appear to have obstructive sleep apnea at first, but unlike typical obstructive sleep apnea patients, their symptoms are not adequately addressed by Cpap. Because Cpap is normally extremely effective in treating obstructive sleep apnea, the patient's failure to improve symptoms would indicate central sleep apnea. Breathing issues persist in people with complex sleep apnea syndrome even when the airway blockage is addressed and treated, indicating that something other than collapsing throat muscles is contributing to the apnea. The issue is that there is still a lot of disagreement among sleep medicine experts regarding what really causes complicated sleep apnea and what the fundamental criteria are that define it.